Hello friends, I am Dr. Vikram Jaggi. I am the Medical Director at the Asthma, Chest and Allergy Centers. These are premier centers dealing with asthma and allergic diseases. We have been doing this for 25 years. We are in Delhi and in Gurgaon. And this is about counseling the patient of asthma. Treating acute diseases and treating chronic diseases, according to me, is a very different ballgame. Acute diseases, we need what is very important is clinical acumen, diagnostic brilliance, cutting edge treatments of various kinds. But in most of the run of the mill chronic diseases which we encounter in the outpatient setting, here those things are important. But much more important, according to me, is the doctor's attitude towards the patient and the disease, empathy, partnership with the patient, willingness to talk, engage with the patient and explain things in an easy way, communication skills, and eventually empowering the patient with a chronic disease to be able to take care of the disease by himself or herself. And how does that happen? So this is the topic for today's talk. So according to me, after treating asthma and almost treating only exclusively asthma for the last 20-25 years, the real challenge of asthma management begins after writing the prescription. Prescription writing is almost nothing, anybody can do that. The real challenge is what happens after writing the prescription, and in that patient education is important. So what is patient education for asthma? Why is patient education important in asthma? Who is to be educated, who is to educate, and what is to be taught? Let's just go into it briefly, very briefly. Why is patient education important in asthma? Because the patient is coming to the doctor maybe once in 3 months or 6 months and spending 1 or 2, 10 minutes, maybe 20 minutes, 40 minutes. So 1 to 2 hours out of the whole 8,760 hours of the year, he or she is trying to manage the thing herself. So the patient has to be made an expert in the management of his or her disease. Who is to be educated? Of course, the patient, most important. But in the case of children, the parents and the dominant parent, the doctor should be able to identify who is the decision maker in this family, mother or father, and concentrate your energies on that because he or she is the guardian of therapy, so to say. And in Indian settings, please do not underestimate the importance of what the grandparents feel about this because they have a very big say in these matters. Who is to educate? Of course, the doctor, but the doctor sometimes has very little time. So involve your other staff, teach them the basic things. Drug companies, many of the drug companies are very ready to help you with providing patient educators. And internet, the power of the internet can be tapped very conveniently. For those interested, you can go to our website www.acac.in, which is just an example how the internet can be used for patient education. This is a website that we run for many years. What is to be taught? Basics about asthma, that the inflammation is always there, the difference between quick relief medicines and preventative medication, to tell the patient that many times what is appearing to be seasonal asthma is only the tip of the iceberg and symptoms and inflammation is there throughout the year. Ups and downs in asthma are expected. These are some of the topics to be discussed. Now I am coming to the last but a very important part of this talk, how to confidently answer the patient's questions, because asthma patients have a lot of questions, doubts, worries, which become stumbling blocks in the treatment being continued. And I always like to say that before you begin to open the blocks over here, untangle these blocks and open these blocks. Tell them the truth, but tell them in a kind, empathetic way. Dr. Saab, do I have asthma? Yes, of course you have. Will it go away? No, it will never go away. This is not the way. This is not going to work. Use some empathy. Use analogy to explain things, and I'll explain you what I mean. Speak in a language that the patients can understand. I'm not saying English, Hindi, Punjabi. Speak at a level which their social and intellectual capabilities are compatible with. Put yourself in their shoes. If you were an asthmatic, you would also be asking these same questions which appear very silly to you. Ye kab jayega? When it will finish? Do I have to take inhalers lifelong? Don't get irritated by these questions. Answer them. Answer them. So one question the patient will almost invariably ask is, Doctor, can asthma be cured? You can't say, no, it can't be cured. I would say, can blood pressure problem be cured? Can diabetes be cured? Can putting on these glasses be cured? No, it can't be cured. It can be controlled. Likewise, asthma also is a lifelong condition, but it can be controlled so well that you have no symptoms whatsoever and you don't face side effects of the disease. So give an analogy of, say, for example, diabetes, which the patient can comprehend. No patient or nobody expects that the diabetes be cured. They know it can't be cured. Likewise, make them understand that asthma, at least in adults, is generally speaking not cured. There are exceptions, and in children, a vast majority, 50% of them actually get cured. For the children asthmatics, the parents will always ask, Doctor, I have heard that this will completely go away when the child becomes a little older. And the general doctors and the pediatricians keep saying, when the child will be 9 years, it will go away. It doesn't happen. When the child will be reaching puberty, it will go away. That also doesn't happen. Then the parents become very disheartened. They are expecting that something will happen at that time magically. It doesn't happen. Please tell them that only in half of the children will the asthma go away, and around puberty time nobody knows, and in half it doesn't go away, but all of them are well controlled and well managed. Then this question is also asked very frequently that, Doctor, I thought that this is allergy and you are saying that this is asthma. I hope this is not asthma, but I have heard that in asthma this anger, but I am not having all those things. So explain that your air tubes are sensitive, they are allergic. This much the patient can understand. Just like something goes in your nose, it's allergic, it starts sneezing. When something goes deeper, it starts reacting, it starts wheezing. So because of allergy, you have an inflammation in the air tubes, a bronchitis, so to say. So you have allergic bronchitis. And another name for allergic bronchitis is asthma. So you have used the word allergy, you've used the word bronchitis. You have made them understand that they are actually speaking one and the same thing. When inhalers are proposed to be used, there is reluctance and resistance. But doctor, I think they are too strong. No, they are not too strong. They are very weak in fact. One dose from the inhaler is 1/40th or 1/50th the dose of the tablet form, which will be equally effective. So how can they be stronger? They are the last. No, they are not the last resort. They are the first resort. If you have got a problem on the skin, is applying a cream the first or the last resort? It's the first resort. So give examples like that. Are these habit forming? Now this is a little difficult to answer because they are going to be used regularly. So it's not a habit, it's a requirement. I would always give the example of my spectacles. I ask the patient, I am wearing glasses to see because I can't see clearly. Do you think this is a habit? That some bad doctor gave me these specs and after that it's become a habit with me. He understands that this proposition is ridiculous. It is of course not a habit, it's a requirement. So the patient himself then says that, no doctor, but this is a requirement for you. And likewise for an asthmatic person, it's a requirement. Socially acceptable is not a huge problem anymore. Use these examples which we have just discussed. They help. So after reluctantly agreeing to take inhalers, the next question is, Doctor, how long will I need these inhalers? When will I stop them? Lifelong. That's a hard one. So say that you have had asthma symptoms for that many years, 2 years, 5 years, whatever the patient is giving the history. So it is going to be useful. You have had this problem, it is going to continue. You will use the inhalers. Maybe the dose will go down as we go along. Now the patient starts reluctantly agreeing, but he starts to bargain with the doctor, as if he is doing a great favor to the doctor by agreeing to take inhalers. So doctor, if you say I take inhalers and I take them, then is it guaranteed that I will be absolutely alright? So don't say, yes, it's not so. Say there will be ups and downs because of season, because of construction in your house, jadu, pocha, all those things, which bring some more Diwali time, pollution. So little bit problems you will have, but by and large, 90% of the time you will remain 90% alright. That much definitely will happen. So use the carrot and stick approach. If you use the inhalers properly, this is what good is going to happen. If you don't, you will be always shaky. And this the patient can relate to. These kind of examples help that these famous people have had asthma and they live very normal, healthy, active lives. Now, when the inhaler contains a steroid, there is some reluctance, especially in educated patients, especially in mothers of asthmatic children. Steroid phobia, but I have heard this, I have heard that. When you're writing an inhaler with a steroid in it, it's a preventative inhaler, please tell the patient always that this contains an inhaled corticosteroid. It is absorbed minimally from there. It is proven safe for small children, for pregnant women. Safety for pregnant women is not established very easily, so they are safe, and reassure them, allay their fears. One good time for all this reinforcement is that when you have explained everything, but still the patient has stopped the inhaler and comes back with an attack. This is the time to tell, look, I told you that this will happen, see this has happened. So I come to the end of my talk, and I will end with this slide, that according to me, the role of the doctor who's treating asthma is like that of this father who's teaching his son how to cycle. The son is the patient of asthma, the father is the doctor. His job is to teach him how to cycle, how to ride the cycle, and once the child learns, to let him go and do it himself. Thank you very much.